There was some anxiety. I was able to get my vaccination before Ashley. And of course, it's fear kind of the unknown. But I have to say, it was just marvelous where we ended up going at one of the big centers off of the big hospital here. Everything was so well organized. They just had you in. The information was quick.
Yeah, when I went with mine to get hers, I kind of watched how the process was and how we had to go to different stations. Yeah, so that was a good experience for me, so I could kind of see what their experience or what their process was.
I mean, we were in and out within a half an hour. And, you have your 15-minute wait time after the vaccination. It was fine, and I was really impressed. But being of an age where we used to have all kind of vaccinations when I was younger because of polio. I'm an age where I can remember what a scare that was. And a lot of those vaccinations had a lot worse physical effect on me than this one did. So I was really thankful. And Ashley went with me, so she saw the procedure and everything that was being done before it was her term. And other than the sore arm, she did fine also.
So I got my first one in April, then I had to wait a few weeks. Then I got my second one. And when I went in to get my vaccine, they had their mask on. That was a challenge for me because I couldn't understand them because I couldn't read their lips, what they were saying. Even though I had my hearing aids in, I just couldn't hear them because they had their mouths covered up, so I couldn't quite understand what they were actually saying. I did good. My mom, she was right there with me when they asked several questions. I didn't know the answer, so I looked to Mom to help me out a little. I didn't have any fears of getting the vaccine. Mine went when I got mine were really fast.
Welcome to the COVID-19 variants and booster shots, Ask the Expert. My name is Matt Norris from the Center for Health Equity, and I want to welcome you today. Thank you for joining us. We're down here in Bloomington, Indiana, and I hope wherever you are in our state that things are going well for you. First of all, let me do some housekeeping. We are offering the availability of the American Sign Language interpreter. This should be spotlighted for each of our speakers. Let us know if you're having issues with that. We would be happy to help. We have a technical facilitator who's helping us today. Also, I just wanted to let you know if you need the captioning, at this time, it's not available through the Zoom platform. There are some issues going on there, but we are making that available through StreamText, and you'll find that link in the chat window. And that way you can just click on the link and you can certainly adjust the StreamText web page any way you want by increasing the font or changing the font. And just a reminder today that this webinar is being recorded and we will make it available on our website here in the next week or so. but I just want to let you know we are recording it. So if you have friends, family who might have missed it, feel free to share the link with them. And then also our questions and answer. This is the Ask the Expert with Dr. Lindsay Weaver. And we do have the capability, you can put in questions into the Q&A just by clicking on the button that's available there. Just to let you know, we've already have a lot of questions that were submitted in advance. While we'll try to get to as many questions as we can, I just want to let you know we may not get to all of them. And so at this time, I would like to introduce Dr. Jay-Chul Lee, who is the director of the Center for Health Equity here at the Indiana Institute on Disability and Community. And he has some information to share with you about our project and a couple of announcements. Jay-Chul?
Okay. Hello, everyone. I'm Jay-Chul Lee, directing the Center for Health Equity here at Indiana Institute on Disability and Community at IU Bloomington. Thank you for attending our second webinar about COVID-19. We have been hosting webinars to increase the vaccination rates of Hoosiers with disabilities and caregivers. Today, we have two disability advocates and Dr. Weaver, Indiana State Department of Health Chief Medical Officer. Disability advocates will share their experience in COVID-19 vaccination. I know many of us, including myself, are quite concerned about Delta variant and have questions about COVID-19 booster shots. Dr. Weaver will be available for your questions submitted during the webinar registration process and during this webinar. By the way, we are very happy to share with you a great piece of news. Last week, we got awarded one grant from the Association of University Centers on Disabilities and the Centers for Disease Control and Prevention, CDC. In an effort to reach out to disability community at a local level, we will serve as a regional hub for local communities from this month through September next year, 2022. We are one of the 4 grantees in the nation. With this grant, we will focus primarily on Indiana, but expand our efforts to our neighboring states, such as Minnesota, Wisconsin, Illinois, Michigan, and Ohio. We will collaborate with disability advocates, including Centers for Independent Living. We really try to emphasize we need a collaboration and partnership with disability advocates, and we will provide more information soon. So please stay tuned. We hope this webinar will help boost the vaccine confidence and increase vaccination rates among Hoosiers with disability and their caregivers. Matt, I will turn it over to you.
Thanks, Jay-Chul, for the update. That's great news, and I'm glad we'll be able to continue this important work here in our state. And at this time, a lot of you we've been sharing with you our resource list, and at this time, I thought I might be able to show that to you by sharing my screen here and showing you what would be available if you visit our website. And the URL for this resource list has been provided to you on our website. We had it at the opening. And I just wanted to show you that this is the resource list we keep talking about, the access our resource list, and lots of great resources that are available, videos, how to go about scheduling your vaccination. We have several resources that we have actually produced here at the Center for Health Equity in collaboration with people with disabilities and family caregivers. So I would encourage you to visit our website and click on the vaccination resource list. And we are continually updating this and reviewing the resources that are available. So feel free to take a look. And if you have any questions, don't hesitate to contact us. And at this time, I would like to welcome Peggy Holtz, who is my colleague here at the Center for Health Equity, who will be joining us with our two panelists, Jared Price from the Terre Haute area and Marty Stone here from the Central Indiana area. Peggy, I'm going to turn it over to you.
Thank you, Matt. And I want to thank Marty and Jared for joining us today to talk about their vaccine experience. So to start off, I'd just like to have maybe Jared start with telling us why he decided to get the vaccine.
It was actually really quite simple. My entire family is involved in emergency medical management, firefighters and everything like that. So they are in constant contact with the public in general. And I also found out that my father recently, before the pandemic began, had been diagnosed with cancer. So I wanted to do everything I could to protect him as well. So those were the two main reasons as to why.
Thank you, Jared. Marty?
Hi, I have a high-risk health condition for complications for COVID. My husband does too. And we have he's now 17-year-old son. He has nonverbal autism and he also has lung damage. And so he has a high-risk condition too. And we were worried who would take care of my son and his sister if something happened to us, you know. So we jumped it. As soon as we could get the vaccine, we jumped at the chance.
So Marty, I have to ask you, I know you were excited to get the vaccine, but did you have any hesitancies at first about it? And if you did, you know, what did you do to calm those concerns?
My son is a little person. So even though he was eligible when his age came out, I kind of worried since his body weight is lower than a lot of people. So I went to the Little People of America website and got some advice from some of their experts and talked to our doctor and felt comfortable with him getting the dose of the vaccine.
Okay. I have to ask, did he have any concerns that you had to address with him?
He was a little bit worried when we saw that there was a side effect for one of the vaccines, and I assured him that we were not scheduled to get that vaccine, that side effect would not affect him.
Okay. Jared, how about you? Did you have any hesitancies, and you know, how did you address any concerns you might have had?
I am both legally blind and I have cerebral palsy. So for me, knowing the risk of potentially being on a ventilator was a real fear. And so what I chose to do was to look at trusted resources, such as I use Resource Page, as well as talk to my doctors and all of my family members who, of course, are involved in the medical field. And the general consensus was go ahead and get the shot because the effect outweighs the risk.
Okay. Well, so now, Jared, now that you are vaccinated, you know, what are some of the benefits to being vaccinated?
For the longest time, I was not able to see my family on a regular basis because of how closely they worked with the public. So now our entire family is fully vaccinated now, and we are able to have get-togethers on a regular basis.
Sorry, go ahead.
As well as being able to do one of my favorite pastimes, which is get on a cruise ship, which I know a lot of people probably think that that's probably not the best place to be, but I can promise you they were very sanitary and safe.
I think you just finished up a cruise.
I did.
And I also, I know you talked about, you had a niece that was, you missed out on seeing.
Yeah, I missed out on seeing basically almost the first year of her life just because we we couldn't get together. So it was really nice. Once she actually turned 1, we were able to, through the grace of pictures and cell phones, we kept in contact that way.
It's nice. Marty, what are some of the benefits you've seen from getting the vaccine? And also, why is it important to get the vaccine?
We finally went to see my father in May, and he is elderly, and we felt comfortable that they were vaccinated and that everybody in our family that could be was vaccinated. So we made the trip and finally was able to see them. And my son's in public school in person this year. He was virtual last year, and he's very happy to be back in person. And I like to do what I can to help my family and help my community. If by getting vaccinated, I can help others in my community, that's something I'd like to do.
So what was your vaccine experience like for you, and then also for your son?
I was slightly tired the next day. My husband had it a little worse. He was kind of iffy for just about a day. And then once he had a good sleep, he was fine and back to doing normal things.
And what was your son's experience like? I mean, from the time that you got there to getting the shot?
He was a little bit nervous to get the shot. He wanted to get the shot, but he was a little nervous. So the staff helped us for him to get the shot. As far as I know, he didn't have any side effects. He's nonverbal, so it's kind of hard to tell sometimes.
Mm-hmm. Thank you. What about you, Jared? What was your whole experience like of, arranging to get the shot and then finally getting the vaccine?
Well, I will be honest. My partner Derek arranged every vaccination that's been done. I have completed all 3 through the Pfizer vaccine. And as far as what I saw as the recipient of a vaccination, I thought it was very well organized. I mean, we were in and out. Waiting our 15 minutes was probably the longest part of the whole process.
Okay, great. So if a person with disabilities is hesitant about getting the vaccine, what would be some advice you would give them? Jared?
I would say that you need to do your research, that you should rely on your support system that you have around you. Talk to your friends, talk to your family, talk to your doctor. We all have a shared responsibility to do what is best for everyone.
Thank you. That was great. Marty, what advice would you give to someone who might be sitting on the fence about getting the vaccine?
I would go to trusted news sources to get your information and do your research. There's a lot of stories out there where even younger, healthier people are having severe complications or losing their life from COVID. And a vaccine can help reduce that risk or prevent it.
Okay, thank you. Did you have any other thoughts about the vaccine that you wanted to share? Either Marty or Jared?
If you have a condition that has a national website, you can always go on there. A lot of them work with medical experts and can give you any information that's been released about your condition or your genetic syndrome.
Okay, thanks. Well, I think we're close to our time, so I want to thank Jared and Marty for joining us today to share their experiences. And I will turn it back to you, Matt.
Great. Thank you, Peggy. And yes, thank you, Jared and Marty, for joining us today and sharing your vaccination story and bringing up a lot of great points. At this time, I would like to kind of move on to our Ask the Expert. And we would like to welcome back Dr. Lindsay Weaver. She has graciously offered to come back and take some time again away from her busy schedule to join us today. And as Chief Medical Officer for the Indiana Department of Health and a faculty member at the Indiana University School of Medicine and a practicing emergency medicine physician, we are very glad to have this expert. We are very glad to welcome you, Dr. Weaver, to share your knowledge and expertise.
Hi, everybody. Good afternoon. I'm very happy to be able to be here with all of you and talk again about COVID. I'm going to share my screen. I have some slides just to make sure I cover all the things I want to be sure to update you on. And hold on just a second. There we go. Are you seeing the main slide screen?
Yes, it looks great.
Perfect. Okay. So good news is that we are seeing our cases of COVID-19 drop pretty dramatically. So this is now the third week in a row where we have seen our cases drop. And we expect to continue on that trend at this time. So if you kind of follow that line along, you can see that right there at the end of August, early September seemed to be our peak at 42,000 cases a day, and now the cases are going down. That doesn't mean that we're out of the woods. Just because they're headed in the right direction, it doesn't mean that there's not still a lot of infection out there. So just like on the way up, when we were at, the 2,000 plus cases a day across Indiana, that's a lot of people that are currently infected and could infect you and your family. So you should still be taking precautions, but we are glad to see that those cases are starting to go down. Also, thankfully, our hospitalized COVID patients are going down as well. Typically, we see our hospitalizations for COVID go down a couple weeks after our number of cases, and that is what we have seen this time as well. The other thing I want to point out to you on this slide, that this is cases over time. So the whole time of the pandemic, and you can see we have these ups and downs like a wave. These waves are occurring depending on how you look at it, but you reach the next peak about every 4 to 5 months. So we have 2 months of going up, 2 months of going down, and another 2 months of going up, followed by another 2 months of going down. So the question is this the pattern that will continue to go on? In that case, we'd expect to see another peak in February. But there's a lot of people who are thinking that maybe this is our last big wave because we have the vaccines and we've also had so many people be infected. So I really like to show this slide because people ask me about breakthrough infections all the time. So that blue line on the top is the number of people that are admitted to the hospital that are not vaccinated. That orange line on the bottom are the number of people who are vaccinated who are admitted to the hospital. So those would be breakthrough infections. So they've been vaccinated against COVID, but they still end up getting COVID and end up getting hospitalized. You can see that there is a huge difference between people in that blue line who are not vaccinated and the people on the orange line who are vaccinated. So if you look at the peak there on the right, on one day we had 1,715 people who were hospitalized that had not been vaccinated compared to 97 who had. So that means that people who have been vaccinated only make up 5% of all people who have been hospitalized. So that shows that vaccines are really working to keep people from getting into the hospital. So this is ICU admission. So people who require critical care because they're just that sick from COVID. And again, you can see that blue line of the unvaccinated is way higher than that orange line of people getting vaccinated. So this is even better than the hospitalization numbers, that the vaccine really protects you from getting that severe illness that may require you to be ventilated or and have to require that severe high level of treatment. So on the highest day, we had 296 COVID unvaccinated people admitted into the ICU, compared to only 19 people across the entire state of Indiana who have been vaccinated that required ICU care. So again, to talk a little bit more about vaccine breakthrough cases. So of everyone who's been fully vaccinated, so that means you've gotten both shots of the Pfizer or Moderna or one shot of the Johnson & Johnson, only 1.2% of those people have ended up getting a breakthrough case. So you can see that the vaccines also, besides protecting you from hospitalizations and deaths, they do still protect to somewhat of actually getting COVID. So you still can get COVID even if you've been vaccinated. Your risk of having a severe illness or being hospitalized is really low, but it does also help prevent infections. So your risk of being hospitalized if you're fully vaccinated is 0.02%. So less than 1%, way less than 1% of people. And then deaths is even smaller, 0.01%. So here's, that shows it to you in bubbles. So that big gray bubble is everyone who's been fully vaccinated. In Indiana, we're almost to 3.3 million people. I hope to get there by the end of this month. And you can see that little purple dot is the number of breakthrough deaths. The green dot is breakthrough hospitalizations, and that blue dot is breakthrough cases. So you can see that it's a very, very small number compared to the large number of people who have been vaccinated. So here are our vaccine counts. These are actually from last Friday. And you can see that we're continuing to vaccinate people in Indiana. Here it is by population. So our older people did a really good job of getting out there and getting vaccinated. For example, our 75 to 79-year-olds, over 80% of that population has been fully vaccinated, which is just incredible. But the younger people get, the lower we see that number. So you can see there in the 12 to 15, it is, I can't see, I got a 32% of people have been fully vaccinated. So a much smaller number. And we have seen a lot of cases in younger people with this Delta variant wave. We also pay attention to things like race and ethnicity, and also something called an SVI, or social vulnerability index, to see where are people and what different groups in our population are or are not getting vaccinated. It really depends when we look across the state. So some counties, we see the lowest vaccine numbers in our 50 to 60-year-old men group. Other counties, it might be the 20 to 30-year-old men group. It's almost always men who are less likely to get vaccinated, but depends on where you look, and also same for race and ethnicity. So we work with, when we're trying to get out there and talk about vaccines, we work with community organizations, we work with churches, for example, Goodwill, we did some vaccines initiatives with Goodwill. We've done vaccine initiatives with different churches and different community organizations. We really found that we're most successful getting people vaccinated when we bring the vaccine to them and they get to be vaccinated with the people who they trust, work, play, live with. And so that's a lot of the work that we're doing right now. We still have our big vaccine clinics that are open for people to go and get vaccinated with, but a lot of our effort most recently has been more targeted. So information about where we're at with vaccines and where we're going. So Pfizer booster doses have been approved, and Pfizer booster doses are approved for people who have completed their Pfizer boost or their Pfizer series. So that's 2 shots, 21 days apart, and they're 6 months after they have finished that series. You also have to be 18 years and older. The reason that's important to remember is because 12 to 18-year-olds are eligible to get the Pfizer vaccine, but they are not eligible for the booster. So you have to be 18 years old and older, 6 months after the Pfizer, and you had to have gotten the Pfizer vaccine. The FDA and the CDC reviewed all the data about the Pfizer booster doses, and they are recommending that people ages 65 and older should get the booster dose, that residents age 18 years and older who live in long-term care facilities, and I would really say any group home setting should get the Pfizer booster, and that people ages 50 to 64 who have an underlying health condition should get the Pfizer booster. They also said that if you're 18 to 49 and you have a underlying medical condition, or if you're 18 to 64 and you work in a high risk place for exposure to COVID, that you may get the booster. I will tell you from the Department of Health standpoint, if you meet the minimal criteria of being 18 years and older, received Pfizer vaccine, and you're 6 months out, you can go to any of our vaccine locations, and you do not have to prove why you're eligible. We just ask for you to attest that you're eligible to get the booster, and it will be given to you. So you don't have to get a note from the doctor. You don't have to prove where you work. You don't have to tell us what your underlying medical condition is. If you feel like you meet the criteria, then we want you and encourage you to go out and get the Pfizer booster. So that's 1 shot. It's the same amount of medicine that you had before, and they have found that the side effects are very similar to what you would have, the side effects that you had when you got your 2nd shot before. So arm soreness, being tired, achy, some people get a low-grade fever, but it lasts 24 hours, maybe 48 hours at the most. And the goal of the booster shot is that they found that over time, your immunity wanes. So over time, your antibodies start to go down. And so the goal of the booster is to boost your antibodies back up. This is very similar to the series of vaccines that you likely got when you were a baby, or if you have children that you got for your children. So, you know, there's several of the vaccines you'll get at when they turn 12 months old, and they get their 2nd one at 18 months old, and then they'll get a booster when they turn 4 or 5. So this is the same type of pattern that we've seen with other vaccines, where it requires that booster shot to boost the antibodies back up again to help you fight infection. And it also makes the vaccine more effective than it even is against hospitalizations and death. Just a reminder, already there's available for an additional dose for people who are immunocompromised. And those are for people who got the Pfizer or the Moderna vaccine. And you can get a Pfizer or Moderna additional shot. That additional shot, you get 28 days after you finish your series. So what is it? Why is it different? What's than the booster shot? This additional shot for immunocompromised people is really because we found that people who have cancer, people that have had a organ transplant and have to take medicines to help suppress their immune system, they really need that additional shot to get them up to where most of us are, who have good immune systems, are by just getting the 2 shots. So it's kind of like, you know, if you're immunocompromised, instead of having 2 shots, you really needed 3. Different than the booster shot. Again, the booster is because over a long period of time, so in this case, 6 months, we see your antibodies start to go down. And that's why the booster shot is recommended for people who have underlying health conditions or older than 65, et cetera. So those immunocompromised people who are eligible for that additional shot 20 days afterwards are people, like I said, active cancer treatment, organ transplant, a stem cell transplant, have an immunodeficiency, have advanced or untreated HIV, or take high steroids that may suppress their immune system. So where are we going next with vaccines? The Moderna boosters, their first meeting, so the VRBAC, which is a vaccine review committee that will review all the data that Moderna puts forward, will start reviewing that data at the end of next week. After that, then the FDA has to put forward its information, and then the CDC has to approve it. So we're really expecting that the middle of October is when they will approve the Moderna booster dose. It's going to be a smaller dose than the original series. And again, what we're hearing is higher vaccine effectiveness against hospitalization and death, and the same side effects that you got after your second Moderna dose. Johnson & Johnson, I know a lot of people got the Johnson & Johnson vaccine. They're also going to be meeting next week about a booster shot for Johnson & Johnson. I will say that they found that Johnson & Johnson vaccine has been 81% effective against hospitalization. And they have not really, some reports have said that they didn't see it wane over time as much as they saw with the Pfizer and the Moderna. Either way, they will be reviewing booster shot information, and they've come out and said that after the booster shot, it's 94% effective against preventing symptomatic disease. So again, expecting the Johnson & Johnson booster shot to be eligible mid-October. Lots of things going on right now with vaccines. The other thing that they're going to be discussing next week, October 14th and 15th, is whether or not you can mix and match vaccines. So if you got 2 Moderna doses, can you get a booster in Pfizer? Or if you got 2 Pfizer doses, could you get a booster in Moderna? And then we'll have to see if they say anything about mixing and matching with the Johnson & Johnson. So expect more information to come out about that in mid-October as well. And I know a lot of this is really confusing, especially because we are not really sure exactly what they're going to say here in a couple of weeks, but just know that there's that people are reviewing the data. Everything looks very promising so far. And we just have to make sure that it goes through all the proper meetings and steps before it's fully authorized and approved. And that way we could be confident in the process. The other thing that's on the horizon, but it's going to be more the very end of October, early November, is that Pfizer did submit the information for 5 to 11-year-olds to be vaccinated with the Pfizer vaccine. So their first meeting that starts that process of lots of meetings several days in a row is October 26th. And so that'll start the process. But like I said, it won't be until, maybe the 29th or the 30th before it would move through and actually be approved. This will be a smaller dose than what the adults received. It'll be 2 shots, 21 days apart, just like the adults who received Pfizer. And they found that the children who received these vaccines got a similar immune response to the 16 to 25-year-olds from their previous studies. And they also found the safety profile to be very similar. In the study, they didn't have any instances of myocarditis. Now, it would not be surprising, though, when they would start vaccinating lots of people to have some cases. But the risk of having myocarditis is much smaller than the risk of being hospitalized from COVID. Also, to remind people that kids get myocarditis from COVID itself too. Myocarditis is something that we see, though rare, something that we see when people have an inflammatory reaction, a lot of times from viral illnesses. So you can get myocarditis from COVID just as well as you can get it from the vaccine, but actually much smaller risk from the vaccine than you would from the virus itself. I did want to take a minute to talk about vaccines in pregnant women. Unfortunately, we have had pregnant women die of COVID here in Indiana. And we've also had babies die from their mothers having COVID. You've probably seen this in news nationally that you are at increased risk for severe illness, requiring critical care and even death if you are pregnant compared to somebody, your age and your same health factors that is not pregnant. But what we do know is that the COVID vaccine does help and decreases that risk for hospitalization and death. I know that there's a lot of people who are worried about the vaccine for themselves and for their baby if they're pregnant, but I want to assure you that all the studies are showing that it is safe and that it is effective. All the national organizations who deal with pregnant women have now come out, including the CDC, and strongly recommended that pregnant women or women who are considering becoming pregnant get vaccinated against COVID so that they do not have this increased risk for hospitalization. I will also share that if you get vaccinated while you're pregnant, that they've seen where those antibodies actually pass on to the baby. So the baby likely has increased protection from COVID-19 at birth as well. So like I said, COVID-19 vaccination is recommended for all people ages 12 years and older, including people who are pregnant, breastfeeding, or who are trying to become pregnant now or might become pregnant in the future. So please share that message. We also get a lot of questions about fertility. So there is currently no evidence, let me repeat, no evidence that any vaccines that you would get any time in your life, including the COVID-19 vaccine, causes fertility problems in women or men. What we do know is that we have found that people who are just against vaccines in general often put this out there as a scare tactic. So they don't have any evidence to support it, but they use it as a scare tactic to try to get people not to get vaccinated. So there's no evidence, once again, scientific evidence that says that it affects your fertility, but we do know that you could actually be at increased risk if you were to be pregnant or if you're pregnant. And that is the end of my show. And I am, of course, will be available for questions.
Great, thank you. And I was going through our list here. Looks like you've touched on a lot of the questions that were submitted, but I do have some questions here. We had a question from the audience. What is the range for the breakthrough cases?
So anybody at any age can be a breakthrough case. I will tell you that our—
I'm sorry, let me just clarify. They said,
yeah.
What is the date range? Sorry about that.
Oh, the date range for a breakthrough case. So a breakthrough case, we consider you a breakthrough case if you get COVID 2 weeks after you've completed your vaccine series. And that's actually a great question because 2 weeks after you complete your vaccine series, even though you're considered fully vaccinated, we do see people continue to get higher antibodies in the several weeks after you're considered fully vaccinated. So that you're still kind of at that medium risk. I also want to share with people, you know, some people have said with the Delta, it's too late for me to get vaccinated. The Delta variant's here. That's not true. So if you get your first shot today, you're actually starting to get the benefits of that vaccine 2 weeks after your first shot. And then when you get your second shot, the 2 weeks after that is when you're really at that high level of vaccine effectiveness, and it continues to go up. And it stays up for a long time. Now, again, that's why the booster shots aren't recommended until 6 months out, because that's how long that high effectiveness is lasting before we start to see it wane.
Great, thank you. Here's a question we got from someone. What can parents do to keep their children safe, especially if they are not eligible yet to receive the vaccine?
So I totally understand. I too myself have 3 of my 5 kids are not yet eligible for the vaccine, and I will share that my 2 older ones who are both fully vaccinated now. So we're really happy about that. My one had just turned 12, so she was excited to get her 2 shots and join the club of the vaccinated people. So for my little kids, it's just trying to make good choices. I'll be honest, for me, you know, they wear masks in school. We try to do, if we're doing activities, we do outdoor activities, which we find to be very safe. This is a really good time of year to be doing outdoor things. And just, you know, if they're going to a birthday party, is it outdoors? If it's indoors, will people be masked? You know, trying to avoid like highly crowded indoor spaces. And just trying to make good choices. I think that, you know, I'm thankful that my kids' schools have chosen that everybody has to be masked. And I know that's not all schools. And so sometimes parents are struggling with, hey, I'm sending my kid to school in a mask, but his friends aren't wearing a mask. And I'm not sure if he's wearing it or she's wearing it. And I think it's just important to kind of talk to your children about, you know, why you're asking them to do the things that they're doing. And I think the kids, honestly, they adjusted to masks better than a lot of us adults have. I have found that they, you know, they'll put it on, they'll wear it, and they'll forget about it. They'll just kind of move on throughout their day. And I think the other important thing is we hope that this is not forever, right? We don't think it is. We're going to have to learn to adjust to those waves and the high peaks and the low valleys that I showed you earlier. And so I think we'll learn more and more from the CDC and from research, you know, when is it okay to stop that masking if the cases are low enough, right? And then we have to pay attention if they start to go up again, when we say, okay, yeah, probably now's a good time to mask again.
Great. And this is a great follow-up question from the audience about masking. What is the latest advice on masking when people are outdoors?
So if you're high risk, so if you're like a chemotherapy patient, or you have had an organ transplant and you're high risk, I would be very careful about any kind of crowded space. That being said, if you are you're not immunocompromised and you are outside and you're not where you're like shoulder to shoulder, it's safe, right? It's the best air exchange system that we have, right? I don't know if you remember, but they are recommending a lot of buildings and hospitals, et cetera, have improved their airflow so that air exchange to kind of pull the virus out of the air. Well, that is what our outside does for us. It's just so much space out there that it just kind of dissipates in really low risk. Now, if you're having a face-to-face conversation with someone and they're coughing or they're singing in your face, there is some level of risk there. So I think you just have to kind of decide for you, are you vaccinated? What's your level of risk? How close will you be to other people? And take all those factors in.
Great. And here's a couple of questions related to boosters. If I receive the Moderna or J&J, will I be able to get the booster shot of the Pfizer?
So that is some of the information we're waiting to find out. So on October 14th and 15th, they're going to start talking about that process. And then we expect for them to come out with a final recommendation that following week.
Okay, great. And this is maybe a lot of people can relate to this one. What if I lost my CDC vaccine card? Can I still get the booster shot?
Yes, you can. So we are recommending, if you have it, to bring it with you so we can go ahead and fill out that next line for you that you got your booster shot. But if you don't have it, we will still give you the vaccine. They'll give you another card and just kind of write on there that it's the booster for you. So don't worry about that.
Great. And this is an interesting question. What information do we need to know about the reliability of COVID tests, such as the antibody tests, rapid tests, and home test kits?
So, so as far as like testing for COVID, your home test kits are probably going to be the least accurate. And the reason for that is that, us home people who are testing at home haven't been trained on the proper technique. There is a chance that you could not, put the reagent on there correctly, not time it correctly. There's just lots of opportunity for error there. So probably your least accurate. I would follow that up with the rapid test. So we find them to be about 60% accurate in detecting whether or not you have COVID. So this is for COVID positive people. So it'll miss about 40% of COVID positive people. And then your PCR test, so that's the test that you do and it goes to a lab and they test it at the lab, that's only 70% accurate. So no test is 100%. That's in general in medicine, but specifically with these tests, we do see it miss about 30 to 40% of people who are positive. That's why it's so important if you have symptoms that you continue to stay home, and that if you're like, hey, like my spouse has COVID, I have symptoms, but my test is negative, that you probably have COVID, right? So behave like you have COVID, go ahead and get retested, stay away from other people. As far as the antibody tests really aren't great to use in everyday life, right? It's kind of even if like for, have a negative antibody test, it doesn't necessarily mean that you haven't been infected. So it's just not really a great test. And then even if you have positive, what does that mean for how protected you are? It's not really an easy thing to measure. There's only one instance that we use it really in medicine for COVID, and that's when sometimes these kiddos that get that multi-system inflammatory syndrome, when they come in, they actually don't have the virus in their nose anymore. And so that's why we check the antibodies to see, did they possibly recently have COVID? Because we see them come in 3 to 4 weeks after they've had their COVID infection. So that's the only time we use it in medicine. Otherwise, it's almost kind of like a curiosity thing, whether or not you test positive.
Great. Here's a question. It looks like, why do people who have had COVID still need to get the vaccine? I'm guessing it might be someone who they hadn't, maybe they think they have immunity or something.
Yeah, so we do still recommend you get the COVID vaccine even after you've been infected, because we don't know how long your natural immunity lasts, right? So right now, you're only considered protected natural immunity wise for 90 days after you've been infected. After that, if you're exposed, you still have to quarantine. If you get sick, we still recommend testing. And so that's kind of that 90 days. Not that some people continue to have natural immunity past that. We absolutely believe people continue to have natural immunity past that. We just don't know for how long or how strong that natural immunity is. There was a study that was done in Kentucky, and it found that if you have had COVID and then you get vaccinated, you cut your risk of reinfection by half. So that's really good, strong evidence that going ahead and getting vaccinated just as further protects you.
Great. And here's another one that's probably at this time a very good question about, does the timing of getting a flu shot or a booster shot or even your initial vaccination, does it matter?
So we, the CDC has come out, and we recommend strongly from the Department of Health to just go ahead and get them done at the same time if it is available to you. So they do not affect each other. Your body will fight both of those vaccines and build up your immunity against them just the same. And then you'll be protected for the winter and what lies ahead of us. We didn't really have a flu season last year, and so we don't know what to expect this year, but there's a lot of people who are worried that it could be pretty bad because none of us were actually exposed to the flu last year. So definitely recommend you to go ahead and get both while you're at it. There's no reason to separate them. At any of the Department of Health sponsored sites, we will be offering, to the most that we can. There's a couple that we have to get somebody different there, but we'll be offering flu vaccine and the COVID shot. Pfizer, we got Johnson & Johnson, we got flu, and you can also get tested for COVID at the Department of Health sites.
Great. And here is another question. What is the state doing to ensure that people with disabilities are being included in the COVID data and also inclusion on task force?
Yeah, so I will tell you from a data standpoint, that definitely makes it harder. We have found it very hard to collect information in general. I mean, even sex, race, ethnicity, age, basic information, and we have found this to be a deficit. Has been a deficit in data, but even before COVID. So I think COVID has shown a light on it, that we need to have a better way of collecting information to make sure that we're doing the outreach that we really need to be doing. Of course, we work with FSSA, who and the leaders for disability there to help us direct where we're going, who we're talking to, and also numbers wise to get information on numbers for us so that we can connect all of our different health information to see, are we getting and targeting the groups that we're most worried about. Avenues like this where we have the opportunity to get in front of all of you and talk to you, answer questions, hear what's working, hear what's not working. We've of course still have the Homebound Hoosiers program that's available for people to call 211 if you need to have the vaccine brought to your house, if you are disabled to the point where you can't leave your home, and continue to work with our long-term care facilities, group homes across the state to bring vaccine to them. And that includes the boosters. So now we are kind of going back around and saying, okay, where do we need to go with boosters? Especially since, Pfizer's come out, but we do expect Moderna and Johnson & Johnson to come out here in the next couple of weeks. So that'll help our effort and make it a little bit easier to kind of get out there and target everybody.
Great, thank you. Dr. Weaver, this one last question, and I think it's a great one to end on. So what can we do to help others, especially friends and family, be open to the idea of getting the vaccine if they downplay the risk of getting COVID or continue to get misinformation about it?
Yeah, thank you for asking that question. That is such a good question. And the fact that you're thinking about it is really the best thing, because it is those conversations between you and that person that's hesitant that is making the big difference right now. So as a provider, I think the best way to do is to ask open questions, right? So what are you most worried about? What have you heard? What would you need to hear to make you willing to get the vaccine? Do most people who have no health conditions and who are young do well? Sure. But how do you know you're not that small percentage of people who will not? We've all seen these things in the news of, I think we just recently had a firefighter here in Indiana die at a young age from COVID. Of the 2 parents of 5 young children who died from COVID, and now, their children are orphaned. Grandparents, who've been raising children dying. So I think that the thing is that your risk may be low, but it may not. But we have something that is safe, that is effective, and will, if you're already young and healthy, almost eliminate your chances of having severe illness or even dying. So it's kind of really a why not, right? Why would you not take this extra step to protect yourself? And if you don't want to do it for yourself, then do it for your family.
Well, looks like I have a late question here. The vaccine is recommended to enhance the body's developed immunity, but there's possibility that it will reduce natural immunity capabilities. Is there information to address this concern?
So I've not heard that. Really the two, if you look at the antibody studies, the two compound each other. So people who've been vaccinated and have had COVID either before or after they've been vaccinated have even a higher level of immunity than people who've had natural immunity or people who just had the vaccine. So I have not seen where it decreases, where it only kind of compounds and increases your immunity.
Okay, well, thank you, Dr. Weaver. Once again, thank you so much for joining us, taking time out of your busy schedule. We really appreciate it. And I also want to, before we conclude here, I want to thank our panelists again, Jared from the Terre Haute area, Marty Stone from Central Indiana. Also would like to thank Jay Chuli from the Center for Health Equity for giving us an update of what the Institute is doing in terms of the COVID-19 vaccination project. And I would encourage you to visit the resource list. I believe one of my colleagues has posted it again in the chat window. Please go and visit the website. There's a lot of great information there that we've put together. The Center for Health Equity has developed, including some videos, fact sheets, information sheets that we would encourage you to share with friends and family members. There's also some very great resources that we've put up on the website from the CDC and from other advocacy groups. And just to let you know that you can also visit the Facebook and look us up, the Center for Health Equity at Indiana University. Might be easier to find us via our website. And finally, we have already scheduled our next webinar. I believe I'll ask my colleague to put that date in there. I think it's Thursday, November 4th. From 1 to 2 p.m. Eastern. We'll have more information on our website and we'll share it through our great connections here in the state. And then last but not least, as you are exiting your Zoom session here, we would really appreciate it if you would take a couple of minutes and complete our feedback survey. I doubt if it'll even take you that long, but we would appreciate any feedback you can give us. And we'll also, if you have any questions, don't hesitate to contact us. And yes, there it is. The resource list is there in our chat box. So thank you all for joining us today. It is almost 3 o'clock and we will be ending the webinar at this time.